An oncologist is generally a physician who deals with the treatment of malignant diseases, also known as cancers. And usually it's a person who's had special training in that area, maybe after a residency in internal medicine or surgery, but it's generally speaking just a person who confines their practice largely to cancer patients. A medical oncologist is a physician who deals largely with just oncology and who is taking care of those patients with medications, sometimes chemotherapies, sometimes immune therapies, sometimes hormone therapies, but their approach is more to the system as a whole, the whole body. So those agents generally are not topical, they're not focal, they're generally more whole body, but it's given by people who are trained in internal medicine to start with. A radiation oncologist is a physician who's trained for several years only in cancer and the application of radiation to treating that cancer. The radiation oncology field includes external beam radiation, but it also includes systemic radionuclides given like intravenously, developing field. It's also the use of brachytherapy or radiation sources that are placed immediately in contact with tumors to give a very precise and very localized type of treatment. Radiation oncologists often get into very esoteric areas like proton therapy, which is the use of high energy ions to treat cancers. So there's a wide variety of things that are done in radiation oncology, and it's a dedicated residency program for several years to look at both learning how cancer behaves, but also learning about how the various aspects of the physics and biology of radiation delivery can work against those cancers. A surgical oncologist is a surgeon who devotes much of their time to the treatment of cancers by surgery. That sometimes would be in a specialized area like ear, nose, and throat cancers, and it usually is a fellowship that follows after a general surgical training. One of the main factors in cancer care is that nobody has all the answers. Unlike any other disease, cancer is really a team sport. It's something that requires a lot of different viewpoints in order for the patient to get the best advice and the best treatment for their cancer. So we tend to orient towards multidisciplinary conferences or tumor boards where the details of the patient's case are presented and then everybody can contribute. The pathologist, the radiologist who look at the diagnostic findings, but then the medical oncologist who talks about how to maybe treat that with chemotherapy, radiation oncologist who talks about various ways that radiation could be used, surgical oncologist that talks about ways to get biopsies or to remove tumors. So it really all has to come together and work together in order for the patient to get the best care. That's why many hospitals have a large number of tumor boards. Ours, fortunately, has tumor boards that are really disease-specific. So we'll have a group coming together just to talk about cancers of the GYN category or brain tumors, things of that nature.